Coming to the catabolism of hemoglobin, when RBCs become old and their walls become weak and their shape changes and finally RBCs are broken down. RBCs are destroyed mainly in the spleen by the reticuloendothelial cells. Hemoglobin is then released from RBC which splits into heme and globin. The end products of heme catabolism are bile pigments. Bilirubin has no function in the body, so excreted through the bile. Globin is broken into amino acids within the reticuloendothelial cells, which will be later utilized for synthesis of body proteins. Iron is then released into the plasma and is transported by transferrin to the storage sites. Porphyrin ring is broken down in reticuloendothelial cells of liver, spleen, and bone marrow, where it gets converted into biliverdin, that is a green pigment. Biliverdin gets reduced to form bilirubin, which is red orange in color, which is then released into the plasma. This unconjugated bilirubin, soluble in lipid solvent, is carried by plasma in combination with albumin to the liver, and it is this form of bilirubin is not excreted in the urine by kidney. In the liver, bilirubin undergoes conjugation with glucuronic acid and forms bilirubin monoion diglucuronide, which is soluble in water. Bilirubin diglucuronide is hydrolyzed and reduced by bacteria in the gut to urobilinogen, which is colorless. Most of the urobilinogen is oxidized by intestinal bacteria to stercobilin, which gives feces the brown color. Some of the urobilinogen enters the portal blood. The remaining urobilinogen is transported by the blood to the kidney, where 5% of it is converted into yellow urobilin and excreted, giving the urine its color. Most of the reabsorbed urobilinogen is re-excreted by the liver back to the gut. So this chart shows the catabolism of the RBCs. Okay, so when they're fragile, they get destroyed in the reticuloendothelial system, where they're going to release the free bilirubin, which is bound later in the plasma to the albumin. So this free bilirubin, that is unconjugated bilirubin, is taken up by the liver cells, where it gets conjugated, and this conjugated bilirubin is excreted in the GI tract and in the intestine. By the bacterial action, they get converted into urobilinogen, which is colorless, and because of the oxidation, they get converted into stercobilinogen or stercobilin, and they give characteristic stool color. And some of the urobilinogen, it is brought to the kidneys, and where some amount of the urobilinogen gets excreted, and upon oxidation it gets converted into urobilinogen, which is important, which gives a characteristic yellow color for the urine.